Okay, let's go ahead and get started. I know some folks are still logging in here. Good morning. I want to thank everyone for joining us today. My name is Jack McDougall, and I'm the president and CEO of the Greater Washington Board of Trade. The Board of Trade launched this briefing series last March when the COVID virus started spreading. I know it's been almost a year since we've been at this. And this is a way for us to virtually discuss very important topics to our members in the business community and folks across the region. Since then, we've hosted more than 30 of these online webinars, and it's been a great way to share expertise and to gain new insights and to have a really good discussion about these issues. I'm really pleased that nearly all of our member organizations have participated in these briefings over the past year, and I really want to thank everyone who joined as a speaker, sponsor, listener, or contributor. So the Biden administration is now in place and moving quickly to enact new policies. But what does that mean for our region, and how will businesses be affected? Our panel today will provide some insights into these early moves, particularly on pandemic response, economic recovery, and more. First, I'd like to welcome our presenter, Dr. Kavita Patel. Dr. Patel has a rich background in health policy, previously working at the Brookings Institution on healthcare reform. She also served as Director of Policy for the Office of Intergovernmental Affairs and Public Engagement in the Obama administration. Dr. Patel will provide us with an overview of the vaccine rollout and then turn things over to our moderator, Evan Krause, who's the President and Managing Director of Operations at APCO Worldwide. Evan will facilitate our discussion today with our great panelists, Dr. Stephen Jones, President and CEO of Inova, Evelyn Lee, President, Greater Washington Region of SunTrust, now Truist, and Chris Scribner, Senior Policy Advisor at Venable. As a reminder, if you have any questions during the discussion, please use the Q&A feature. We'll get to these at the end. And now I will turn it over to Dr. Patel.
Great, thanks so much, Jack, and thank you to the board for having myself and what I hope will be a brief but lively discussion. And I'm just going to start with, and hopefully everyone, yes, I'm all on and unmuted. We're all getting very good at this world of Zoom. I'll put them in the chat. I had a couple of slides, but not because I wanted to read slides, but more because I wanted to offer a bit of context to where we are with COVID. And I know this is really, I'm going to try to bring it a little bit more granular regionally, just because I've been involved. I'm licensed in DC and Maryland and practice in the area, and have also been overseeing some of the vaccine clinics. And it's been interesting to kind of cross jurisdictions. And Dr. Jones will obviously kind of talk about at least what I've observed, which is that Inova kind of did something that many places should have done in the beginning in the region, which is to really kind of apply solid kind of supply chain principles with throughput by having like a dedicated workforce to vaccinations. But that comes at the cost of taking those personnel away from other parts of the operations, which in a hospital or health system can be pretty challenging. But it turns out that that's actually the mechanism to get the throughput. You know, none of us realized at the beginning of this journey, when none of us could have anticipated that less than a year we would have not just one, but two highly effective, and now what looks like 3 and maybe 4 highly effective vaccines available. So that's a great problem to have, but it then created, unfortunately, a lot of the distribution issues. The Biden team is actually doing a kind of an ad hoc COVID briefing later today. So there might be some more interesting news that comes out. But as far as the region is concerned, I think it's pretty safe to say that if I were a teacher, giving all of us, including kind of our Mid-Atlantic region, the Greater Washington area, as well as the country, a grade on how we're doing at vaccine distribution, overall, I would give us a failing grade. But that doesn't mean like any student who achieves a failing grade, that means that all they can do is come up from that level. And so I do feel like that's where we're at. I think that there was a very, in the region, what I've noticed is that we have an incredible number of providers and clinics and hospitals, people who know how to do vaccines, ready to step up. And it's just been this incredibly awkward transition from federal government, McKesson as the third party distributor, the manufacturer, to the different points of distribution in the forms of the state to retail pharmacies, et cetera. The staffing is actually not as much of an issue in the sense that now we have actually through the Mid-Atlantic region, we actually have an untapped resource that still to this day has not been quite tapped, a medical reserve corps, physicians and pharmacists and health professionals such as myself who have said, we're ready to volunteer in the situation of a natural disaster or a pandemic. So it really is the supply issue. And I just want to kind of highlight that the Biden administration, since that's the goal of the conversation today, had originally set a goal which some of us had felt like might have been too ambitious. But now that we have two, maybe three, and in the next several months, possibly four manufacturers, with each having had negotiated at least 100 to 200 million doses, we actually have the supply within our sites. And so now we just need, so the Biden administration increased that to 1.5 million shots a day. Now we're also kind of feeling like that's not good enough. And that has a lot more to do with the presence in our region of these concerning variants. Some of you may have noticed and picked up in the news that last Friday, I believe, recently in the last several days, we had picked up proof that the South African variant was in fact present in Baltimore in an individual who did not have known travel to any of the endemic regions. And that just signifies what many of us in public health know. And I have a background in pandemic preparedness and have worked on West Nile, H1N1, never quite ever thought we would get to where we are here with COVID-19, but here we are. We know that these variants are here. We just don't have approximately in the Mid-Atlantic region, we're still only sampling about 0.05% of our current coronavirus samples are getting genetically sampled. That should increase this week because the FDA has had an agreement put into place with LabCorp, which is obviously one of the largest kind of commercial labs. So that'll help. But we're kind of getting caught, the analogy is that we're kind of on the football field without a defensive line because we don't have, a knowledge of like where these variants are. So our current state is that in the district and in Maryland and in Virginia, we're still kind of in that phase 1B or kind of outside of where I would say we're in like a mass distribution phase. And I think you're seeing that we're plagued with reports of portals and, in the district, for example, online portals being open and slots being filled within 15 minutes. And I think that all around there's a 360-degree sense of frustration. However, I will say this, it's like the flywheel and we're getting better at it. And I think that the jurisdictions are getting much more comfortable with trusting places like Inova, who had already kind of initially had the trust because of the ultra cold storage requirements. But we're starting to also see that if we're going to be able to get especially some of the hardest hit communities, and we have counties in our area, parts of the district wards and counties in Maryland and in Virginia that have had 30 to 40% positivity rates. So there is now a much better awareness of how do we need to target high affected areas. And that's going to be the next phase, including, by the way, the opportunity that the Johnson & Johnson vaccine offers, which should go up for an application in the next 1 to 2 weeks, an easier solution that does not require as much as what I'm sure others can discuss in more detail about the ultra cold storage requirements, which enables us to have a vaccine that's in a fridge and then be easily administered to an individual without having to have that central distribution to a freezer. So I'll say this, that I feel like in our region, even though we're at very low single digit percentages of the whole country, the whole state or the whole district being vaccinated, that I expect, and we've been doing forecast projections, including having staffing slots in our clinics to actually see that ramping up, particularly if we can have access to the Johnson & Johnson vaccine. Unfortunately, as I mentioned, the variants are posing a very unique concern. And I'll just say this I think you've got a really good group of leaders in this phone call. And I would just say to you as private and public sector leaders, I think we're all going to have to make some very difficult decisions here in the coming weeks because of this just slow distribution, largely marked now by supply issues. We are going to have to also face some difficult choices about our reopening metrics. The more of these variants that we have, which pose at least a more infectious risk, there have been some signs and some 10 studies that are smaller in the UK that show that the UK variant, which we know is much more widespread, not dominant in this region, but it is present in this region, is potentially more deadly as well. So many of us are watching, and I think that you're going to hear kind of like a drumbeat from both the Biden administration as well as local leaders around caution in these reopenings, to be incredibly attentive for what I'll describe as kind of small hotspots. When we start to see, for example, in a workplace, a rise in cases that we just can't explain through behaviors, that is a kind of a signal to us in public health that this is something concerning and could point to these variants being a driver. We know that approximately 9% of cases in the region are in children, and so children are much lower in likelihood to contract or to kind of get COVID-19, the disease from the virus. But we can't make these assumptions hold true if the variants prove to be potentially more infectious in children. So all these dynamics are going to cause, I described 2021, and the Biden team has kind of said this when they've done their public briefings, that 2021 is going to be a difficult year. The president has kind of basically alluded to the fact that things are probably going to get worse before they get better. But in some very good news, I do want to emphasize that in the region, for vaccinated populations, for places like long-term care facilities and kind of places where we've seen a majority of people receive the vaccine, we have already started to see a decline, certainly in deaths and also in severe kind of disease that leads to hospitalizations. So it's good news. And then I want to put a plug. I know I feel like everybody wants to talk about vaccines all the time. I do want to put a plug in for the regional efforts to try to introduce the use of monoclonal antibody as well as antiviral therapies, as well as convalescent plasma where appropriate. Clinically, it is something that I am seeing remarkable results in. The key here is to get people to treatment as soon as possible, in literally, hopefully, hours within receiving a positive diagnosis. There are criteria for the use of these therapies. Most of them have to do with age, one over the age of 12, and certain comorbidities. But I'll be candid with you, we in the region, we're seeing an underuse of our current supply. This is another kind of allocation of supply that's kind of regulated and somewhat by the federal government. And we have only been using approximately 16% of our regional supply. We have supply. Antibody infusions, like any infusions, if anybody has had the circumstance of undergoing chemotherapy or any sort of treatment, they understand the process of having some sort of IV infusion. It's not as easy as taking a pill in the comfort of your home, but it has reduced dramatically. And I've seen it firsthand. And I know we've got Dr. Jones and other clinicians on here. It is truly, truly something that should be made available. And we are trying to do a widespread regional information awareness campaign, because the more likely scenario is that you have somebody who tests at a clinic like mine, tests positive, and the clinicians are just not as aware that this is an option. So I just want to state that I think that the group assembled here can do, if I have to leave you with a couple of things, and then I'm going to turn it over to my friend Evan, but I just wanted to see if there's anything that could be useful from a question perspective, or just hand it over to a panel that'll be much smarter than I am about some of this. But I would just say, take home 3 points. Number one, 2021 is going to be a degree of flux from a business operations, clinical kind of confidence standpoint. It'll rise, but we're not going to be in that kind of normal phase anytime soon. That includes everything from school reopenings to consumer confidence to the awareness of local governments to kind of roll back restrictions. That leads me to kind of point number two. We are right now in a phase where demand far outstrips supply for vaccines. We will get to a point, though, where we start to meet the limits of that. It won't be soon, but we will get to the limits of that, and we are going to have to deal with a very real sentiment of resistance. I'm just going to share candidly, in my clinic environment, we have about a 32% healthcare worker, I don't want to call it refusal rate, but initially when offered did not want the vaccines. The majority of those workers tended to be non-MDs, non-nurses, but it wasn't universally so. I'm from the state of Texas, and the same is happening to colleagues in Texas. And I've talked, and we've seen some data emerging. And that's a real resistance that we need to overcome. And I think that'll be reproduced in different populations for different reasons. So number two is information, information, information. We're starting to get regular briefings from the Biden team. You can take those slides and literally just kind of, put that into your employee's environment without trying to be political in any way, because most of what they're covering is really around the science. And then number three, I just want to emphasize, as you're reconsidering or considering policies that impact your workforce or considering policies that impact yourselves, really think about the quality of masks. I think if there's been anything, people like me a year ago were not sure about the role of masks, and I regret that, because if there's one thing that I can emphasize, it's that masks matter, and the kinds of masks do matter. So I'll stop there and hand it over to my friend Evan and see if there's anything. There are two questions. Evan, do you want me to just answer these pretty quickly in terms of
Yeah, it'd be great. Maybe 2 minutes or less because we're a little
Okay.
bit over time. So
Oh, okay. Yes, that's not, I've been accused of talking a lot before, so you're not insulting me. Number of vaccines, pros and cons. I don't think you're going to have a choice. There are pros and cons to everything. Think of a vaccine as an intervention. I would say the pros outweigh the cons. The pros here are the almost 100% prevention of death and reduction, relative risk reduction of severe, moderate COVID illness. To me, that's everything. Cons include that we've only been studying some of this for, it's been a year in many cases. So a lot of people bring up safety issues. That's certainly valid. I think the cons are that we had not studied these properly in pregnant women, breastfeeding women, children yet. They're in trials in the age group of 12 to 16 and 12 to 18 right now. So the cons are that these vaccines are not available to a pediatric population. And then just really briefly, there are no significant safety concerns to the monoclonal antibody treatment. In fact, one of them has actually received full FDA approval and several on the way, which is a strong sign at the safety signals. There are some downside. There are some potential reactions that do come from an infusion, so they do need to be monitored, which is why you have to go to kind of a doctor's office or setting that's prepared to do these. But incredibly effective treatments, something that I highly encourage any of you to kind of look into and advocate if you yourselves or a family or loved one find yourself with a positive diagnosis, and just advocate for yourselves, and please wear a high quality mask. And that's it. I'll stop there, Evan.
thanks, Kavita. I really appreciate your insights. And Kavita's going to drop off for another commitment. And I'm going to invite my co-panelists to join me. So I will keep the introductions very short so that we can jump into the substance. But we have a great panel. Evelyn Lee is the president of our region for Truist, which is the outcropping of the merger between BB&T, which is a bank that's operated in our region for many years, and SunTrust. So together, it's 275 years of service to this community on financial matters. Second is Dr. Stephen Jones, who's president and CEO of Inova, who's one of the most significant providers of healthcare services in our region. It's the leading not-for-profit system, serving more than 2 million people annually. And he has a tremendous medical background in his own right. And then finally, last but not least, Chris Scribner from Venable. And Chris was head of public policy for a bank and worked in a lot of different areas. So it's going to bring a lot of input on the regulatory environment we're facing across a range of issues, particularly ones related to financial matters, which I know are important to the folks listening in. So before we jump into questions, and I would encourage you, as you've started to do with Kavita's presentation, to just put any questions you have in the Q&A. I know some of you submitted questions in advance. We got them and are going to try to incorporate them into some of the commentary that we'll make. Let me just make a couple of political points before we jump right in. I think 6 quick points. The first is this is a slower than normal transition because of some of the issues with the natural order of transitions and when the prior administration made information available, but also because it's a slow process to get folks confirmed. So anything that you hear about 100 days is going to be impacted by a lack of staff. Second is there's a lot of talk about bipartisanship, but there's still an enormous amount of GOP opposition to a Democratic agenda. And there's some fighting within both parties right now between the centrist elements and the more extreme elements of the parties. So in this environment, congressional moderates, we hear a lot about the Senate, but there's a very significant problem solvers caucus in the House, are going to have a little bit of outsized leverage. Third, I think you're going to find that this administration has a lot more focus. and is focusing on pandemic, the recovery, climate change, and equity more than anything else. And I think you're going to hear repetition and focus from the White House in particular. Racial and gender equity have become a priority. We've seen it in the cabinet and some of the folks that have been selected for various posts, but it's also been shown in day one actions, messaging strategy, and other things. So that's a serious focus of this administration. Internationally, there's an emphasis around global leadership and engagement, but there's still some parochial thinking. There's a lot of America First policies that are sticking. And there's a focus on domestic interests. And so it'll be interesting to see how that re-engagement with the world shakes out. And finally, there's a very, very strong wing of the Democratic Party that's liberal and that's activist, and was very disappointed by the promise of the Obama administration because he governed more as a centrist, and feels like they have an advocate in the White House, at least in the vice president's office. And so, there's going to be a lot less patience, we think, for some of Biden's centrist tendencies. So that's going to have an impact broadly on everything that goes on. So jumping into the substance, I'm going to, as we always do on these Board of Trade calls, because it's so important for our business leaders, look at the economic recovery, both nationally within the DMV region. And we have almost no one better than Evelyn Lee to give us a sense of that. So Evelyn, why don't you give us an overall look? What are your economists saying about the economic forecast for the region and for the country, and what impending or possible events or initiatives in health and government can impact that shape and timing of the recovery?
Great, thank you, Evan, and thanks to the Board of Trade for having me and including us in the discussion. First, I'll just make sure, Evan, can you hear me? I'm on
Perfect.
video looking, okay, great, wonderful. Don't want to ramble on eloquently and then be on mute. So I'm probably not going to belabor necessarily the current state of the economy. Most of the folks on the phone with us today are, living in that and inundated with news on that topic, except maybe to restate the obvious, which is the impact of 2020 has really been disparate in different segments of the economy, but also for different segments of our population. And we can talk a little bit more about that. I think, Evan, you'll probably get us into some of those details in terms of programs and how some of the stimulus might affect those different segments. But really, if you step back and you think about kind of the two most important things that could affect the shape of our recovery, is it a hockey stick? Is it an L? Is it a gently sloping hill? It's really two things. And one, Kavita and Stephen will certainly touch on in greater detail with more expertise, but that's really the ability to get people with a little bit more finality out of their homes, back to work, back to school, spending money. That's really what's going to kickstart the economy, especially in some of those segments that have been most impacted in terms of requiring people to gather for them to make money and to recover. So the ability to vaccinate, the ability to avoid variants, et cetera. But again, I'll leave that up to our medical experts. And then really the second is government spending. So it's fiscal and monetary policy around, where do interest rates stay or go? We've certainly backstopped the financial markets with a lot of quantitative easing. So we'll get to talk a little bit more about what we expect there. But, really first week of February is going to be, pretty important in terms of determining the size and scope of what we'll be able to provide. And, again, Chris can speak to some of those maybe back and forth wranglings, but we've got a proposal, we have kind of a GOP counteroffer. And I guess sort of the thinking is maybe do we land somewhere in between, but overall, we're probably looking at $7 to $8 trillion pumped into the system in various ways. So if you do the math, that's, about $20,000 per US resident. But those are really the two main things: vaccination and the stimulus.
Great. So why don't we take those in maybe reverse order? And Chris, why don't you jump in and give us a little bit of input into that back and forth? What's the likely content and timing of the stimulus bill? And what do you think the impact will be to our regional economy of the output of what ultimately comes out?
Yeah, thanks, Evan, and happy to be with the group today. You framed the issue well in terms of that Joe Biden has promised to govern on a bipartisan basis, but he's also promised to move quickly on the economy. And what we see is that pressure as we look to his first big legislative action, which would be a stimulus bill. Most likely, given the need for speed and frankly to match most of Biden's priorities, we're going to see the Senate or the full Congress move using the reconciliation process, which allows for simple majorities in both the House and the Senate. And that means Democrats only. The reason for that is, and we saw the Republicans try to push a $600 billion proposal, but Biden wants to go big. Chuck Schumer has said they're going to go big. So what we're going to see is by the end of the week, the first step in that reconciliation process, that is the budget resolution and the vote on that in both the House and the Senate, that allows the authorizing committees in each body to kind of draft the legislation, which will take place over a couple weeks. And what we will probably see is back in the first post-impeachment in the Senate, but back to the partisanship issue, but in the first week of March, the House and Senate take up this legislation. It can pass again without Republican votes. Still means Senate moderates are key, or Democratic moderates in the House and the Senate are key. What we will probably see, and just to get to the local region, and the reason the Republican offer will be rejected is the Republican offer did not include state and local aid. There will be probably somewhere close to $400 billion in state and local aid. It included only a sliver, a fraction of Biden's $170 billion proposals for money directly to schools, half of the roughly $40 billion for childcare, and some significant difference on unemployment insurance. So if the timing is right, and certainly by the second week of March, a bill will get passed. That already threatening the 100-day analogy, but that will have significant state and local aid, school aid that can flow into the local economy, money for childcare, as well as an extension of unemployment insurance, again, getting money to people in need locally.
Great, thank you, Chris. So Stephen, let's move to you. Since so much of the money is going to be directed towards pandemic relief of various kinds, and how important, as Evelyn said, that is going to be to our economic comeback. Maybe you could share a little bit from your unique perch in the region of an outlook on public health, bridging off of what Kavita talked about broadly, what you see is going to happen in public health across the region and your best guess, and how it might impact the economic recovery. So I think specifically, there's a question in the Q&A about opening schools. A lot of people on this call I know are very interested about when they can welcome employees back to the offices, and certainly reopening businesses and live events like entertainment, a little more ambitious opening of restaurants and sporting events. So maybe you can give us a little bit of a sense of your outlook on the public health implications of all of this going forward.
Probably worth exploring. What do we mean by public health? And I think, like many terms that people use, we may all be talking different things. Public health really is addressing a population-based approach to whether it be obesity, diabetes, or in this case, a pandemic. And unfortunately, I think we've shown that the public health system in this country is woefully inadequate. And that's a conscious choice that's been made over decades. It didn't start over the last year or two. But when the pandemic hit, it became clear that we didn't have an organized national response to that. Now, fortunately, we had a healthcare system across the country, and you can argue about how systematic it is. The healthcare system actually rose to the challenge, I think, fairly well. And we took a disease that didn't exist weeks before. We suddenly were inundated with it, and outcomes improved over a very rapid period of time. I think the real question there, Evan, moving forward is, what do we do differently as regards public health? And I don't think we're going to know that in the next 18, 24 months, because like in any crisis right now, everyone's focused on it. But 2 years from now, will we have changed that? I think what we can see is that this is going to drag out longer than any of us would like it to have done, dragged out. And you can argue about decisions made up until this point about distancing or any of the things that have happened, but we have to take this seriously. Kavita mentioned masking. We've got to take seriously the fact that we can't all gather in big areas here and breathe air on each other and expect that anything will happen other than that this disease continues to perpetuate probably for many, many months. there's a lot of talk about herd immunity as the way that we get out of that. And I believe it'll be a combination of the vaccines, which are extremely effective and extremely safe, a combination of that, and frankly, the herd immunity that's been brought on us because we've had so many people exposed and now hopefully have longstanding immunity. What we don't know, and that is how long immunity from either one of those last. And people might say, well, how can we not know that? Because that time hasn't elapsed yet. So I think it's going to be longer than any of us had hoped. And I think that the more that we are honest with ourselves on that and take very seriously the things that we know can have an impact on that, we will have the ability to, whether it be open schools or gather in person again at some point in a foreseeable future. But it's unfortunately not going to be the spring that many of us had hoped for, barring a major change in vaccine production.
All right, that's really helpful. So let's, just as a follow-up, there was a question in the chat or in the Q&A about schools opening in the fall. Do you have any sense of what you think public health experts are going to recommend in terms of schools reopening? Is it Biden has talked about having people in schools in 100 days? That sounds like you think that's unrealistic. I'd be curious as to what you think about that and about the fall for universities in our region. There's a lot of them for the others, for the mid and the public schools and elementary schools and high schools. Do you think it's going to be virtual, a hybrid, all students back, major changes? What's your best guess?
I think you'll probably see a patchwork across the country. Part of that determined on just the geography and some dependent on where the virus stage is or the breadth of virus is at any given geography. I think what we do increasingly learn is that schools appear to not be the spreader events that many people were concerned that they would be. And we don't know why, but we know that schools have largely not had super spreader events in the absence of very large gatherings of people without masks. So that it's probably going to be deemed feasible, and hopefully there will be some federal clear guidance on it. So we just need a very clear recommendation from the federal level, CDC specifically, on when that makes sense that masked children and hopefully vaccinated adults who are caring for them in the schools can gather again. And I would not rule that out happening within that 100 days, especially if we see an increase in vaccine production and acceptance. I would not rule that out in this geography or any by that period of time, but there's a lot that we don't know right now that will determine that.
Thanks for that insight. So Evelyn, let me swing back to you for a minute. Since you're one of the largest banks serving our region, you're on the front line of the old PPP and the new stimulus that's being planned for small business. So talk to us a little bit about what you think the outlook is. We did one of these right after the election, and there was a lot of talk about the PPP and about how disproportionately the benefits were felt by different parts of our region. And sadly, businesses owned by women and minorities seem to have been left behind. So what do you think is going to happen this next go round, particularly to those underserved parts of our local economy? And particularly, there was a question submitted in advance about the Green Gov small business pilot. So maybe you can comment on that as well.
Yeah, sure. I mean, those are all great questions, obviously front of mind as we really start to get knee deep in the second round of PPP. So, I mean, if you flash back to March, April of last year, and you look at sort of all the steps that we're taking quickly around quantitative easing, et cetera, those really were very effective in sort of the large publicly traded active markets. And of course, for that to have a trickle down effect into the small businesses that you reference, and certainly some of our maybe less well-served small businesses and individuals, it takes a little while. And of course, then we got the shot in the arm that folks were hoping for and needing with the first round of PPP and with the stimulus checks. So as you look at this next round of PPP, and I won't go into all the various details, there's a lot of information out there, and anyone that wants to throw anything in the chat, I'm happy to flip information around, but it is certainly intended for small business. You look at some of the caps on loan amounts, some of the requirements around demonstration of impact, and we really should be driving those dollars to where they're needed. There certainly was a fair amount of scrutiny, and this is all public, around more mid-sized to larger privately held companies that accessed PPP funds in the first round. And I don't think we'll see that same level of interest from those folks with this round. So, as it relates to getting those dollars into minority owned and women owned businesses, I would say editorially that banks, at least in my experience with the bank where I am at Truist, are very focused on that. They're going to be certainly focused on a very fair delivery in terms of, kind of a first in, first out approach to applications, providing, more support this time around. People are stood up with kind of call centers and a better technology platform that should make access easier in general. And then I think, you'll see different banks taking creative approaches just to make sure, in the same way that we're focused on whether we have branch availability in certain markets, ensuring that we get those PPP funds to the right places. So again, I don't want to speak to how each bank is handling it, but based on the way I know that we're handling it, it's certainly a priority, and I hope it will have the desired effect.
And how about Green Gov? Any comment about that?
Yeah, so Green Gov, I don't have a lot of expertise there in terms of the specific program. I think what I would say generally, so I'd have to probably poke around or get some resources internally, happy to do that for whoever asked the question, is that, it's certainly not surprising to see some of these priorities that the Biden administration has around social justice, equity, environmental focus, kind of woven into some of what they're going to do structurally on the business side. I don't think those are going to be the programs that are going to have the broad-based kind of immediate need economic impact, but I would expect to see, a number of those out and available. So I'll have to follow up with more specific details on that one in particular, but that would be sort of my broad-based commentary.
Right, really helpful. So Chris, let's maybe go from small business to big business for a bit. There's a number of sectors in our region that are really important. I think we spoke earlier on, or Evelyn certainly spoke to government stimulus and the direct payments by government to contractors and things like that, which are obviously a huge part of our region. But there are other parts of the economy here that are very vibrant or have been. Audi moved here, so automotive becomes very important. And there's a lot of talk about electrification, and there's talk about an infrastructure bill. We have Bechtel here. So in terms of major construction and infrastructure and broadband connectivity and electrification, and then in hospitality and entertainment and travel, we have major hotels here that are based here. Where do you think the Green's jobs, the jobs initiatives and the infrastructure spending, how do you feel like that will cascade into those hard-hit region parts of the economy and our region, and what do you think the outlook is there?
Yeah, I think, to take the kind of industry sectors in reverse order, one of the questions, really open questions in the kind of current stimulus discussion around PPP and small business is there a way to target this next round to specific industries? And can it be targeted? One of the discussions throughout the end of last year, and which will continue into this year, is should there be a restaurant/hospitality focused fund? And that is something that could potentially get into the reconciliation package that I mentioned earlier. Taking a step back to infrastructure and questions around automotive and kind of incentives around an infrastructure program, that's kind of the next major bill that I think the Biden administration will attack. Given the timing of stimulus relief, I don't think we're going to see that take shape until the middle of March. And because that will need to be a bipartisan bill, given reconciliation will have been used once in stimulus, that will become more challenging. But the focus, whether we've seen private companies, already try to get ahead of the issue around climate change, electrification, automobiles, but the broad infrastructure package, something that Biden ran on, will be phase 2. It will be jobs focused. It will be energy focused. The administration will use that legislation as a way to kind of shift the discussion around energy as well as funding needed projects.
And a quick follow-up on broadband. There's been so much in telehealth and in distance learning and in e-commerce, and that the access to the internet has become such an important driver of all aspects of our society, even entertainment. There's still some major digital divide issues in the rural parts of our region and some inner city folks. Do you think that the government will engage, and in what time frame do you think the government would engage in trying to close some of those issues?
Yeah, I do think, and thanks for raising that point. I think broadband would be an essential element of the infrastructure package. And then if you think about the need to put together a political deal to get 60 votes, that you raised the key idea of both rural Americans and inner city Americans, and that often, just the nature of our politics today means that would potentially bring together Republicans and Democrats to unite around that issue.
Okay, really helpful. So, Stephen, let's go back to you and go back a little bit to the pandemic. Kavita gave us a great overview of the approach that's being used to combat COVID and how it's changing over time. Maybe you could help guide our audience about what they can expect in terms of streamlining the processes for vaccine distribution across the region. Because right now, it is a little bit of a tapestry, and at least if you read the media reports, there's big differences across DC, Maryland, and Virginia, and efforts to combat the new mutations. And maybe in your comments, you can think about some advice for all of us about what we can do to be helpful and part of the solution.
I certainly think it would have been way more helpful had we had a central approach as opposed to patchwork. We've got 51 different jurisdictions determining vaccine distribution, and it creates confusion. I, on an almost daily basis, get calls. In fact, I've quit returning some of the voicemails I get from people who may live in one and work in one and who knows what else in the other, trying to find the best way to get in. And that, again, goes back to a federal guidance on that would be very helpful. And then, of course, it would require the 51 jurisdictions, including the 3 here, to agree to follow that. As far as the variants, I think that they generate great headlines. I think the real issue there, from a standard testing standpoint, we don't do genetic testing on the variant, and that's just because that's not what laboratories do. That's, again, back to a public health requirement. We know the variants are here, and when I say we know that, when we got the first case in Baltimore, I don't think anyone who was paying attention was surprised by that. And I think what that means, there's probably multifold around that already have those variants right now. We know they're more transmissible. We think they're more fatal. It goes back to why we cannot take our foot off the gas on the protections that we know work right now. And it goes back to the need to increase the number of vaccines available. I think if we had that simple, clear guidance we have between the jurisdictions, local health departments, and the various healthcare providers, we've got ample capacity to get vaccines in arm as quickly as possible. It's purely about number of vaccines and how they get to us at this point in time.
In terms of what members of the audience listening in can do, I presume you're going to say, help work within our populations to deal with hesitancy issues, but what else can we do to be helpful?
Your own behavior is important. Many of you have influence over a number of your employees and other people, and very clear conversations on both those. The protections that we need, so we're not exposing each other. And it's not rocket science. It's breath from one person going into the nasal passages of another person. It's that straightforward. We just need to avoid that. And then as regards hesitancy, we need to have honest conversations on it. I think there's been, unfortunately, some malicious activity for a long time in our country and other countries regarding fighting against vaccines. Vaccines have made more difference, have saved more lives than almost anything we can imagine. And they right now are our way out of this. And until we, frankly, fight back and quit allowing the disinformation to continue, and until we address people who have legitimate concerns and address those concerns, we're going to not reach the level of vaccine acceptance that's required.
And one more question for you before we move on. This came in just in the Q&A about regional travel, regional transportation, and to some extent transportation outside of the region through our airports and airlines. Can you give us your sense of, Metro is advertising and trying to promote a lot of what they're doing to keep their system safe. The airports and their airlines, if you're a frequent traveler like me, and you're getting emails all the time from the airlines and from the airports telling us all the things that they're doing. What's your assessment of the safety of travel right now? And again, what guidance should we be giving, our populations like employee groups?
I can't address specifically what any of them have done. I just don't have the information on it. It goes back to us not breathing air from one person into another person. So early in the pandemic, people were focused on surfaces. It was believed that the virus was carried on surfaces because it lives that way. We know that right now that's a negligible route of transmission. So we need to get beyond, and I don't know which ones of these are doing it. We need to get beyond polishing surfaces and thinking that that makes much of a difference. We have to get to where we're not rebreathing air. So if we require mask, an effective mask, as Kavita suggested, I think is a part of that that's probably been understated, and I agree with her on that, but freshness of air. So if I were trying to address the local transportation, I'd be having windows open. That does way more than polishing every surface every 3 or 4 minutes. So if we did that in masking, I think that we can make transportation safe again. That's the lens that I would look at it through.
And from a medical perspective, air quality and air handling systems, there's, I know I don't want to ask you for if you don't know, but on the airlines, they're putting in a significant increase in the quality of air handling systems. If you're in an environment like an airplane where you can't open a window, how comfortable should we be with those kinds of systems in place?
There's no doubt that that's an improvement, and there's no doubt in my mind that we should have done that a long time ago, because I, like probably everyone, you and everyone here, has done a lot of traveling, and we know that the air in airplanes has been pretty stuffy for a very long time. So I hope that's something that's maintained. I think if we had adequate masking, and I'm vaccinated because I'm a practicing physician, I would at this point probably, and I said probably be comfortable getting on an airplane. If the airlines continue to do everything they can to keep that air clean and require diligent masking, I believe that we'll see more safety in air travel here in the coming months.
Great, really helpful. So let's shift gears again to the to a little bit of microeconomics. We talked about the macro, but there's some questions that were raised in the Q&A and also in advance about the DOL and labor policy, things like that. What do you think, Evelyn? Let's start with you. How should we think about Yellen's approach to interest rates or federal programs related to monetary policy? Are we going to keep up the QE and the very low interest rates, and is that going to ultimately help or hurt? Where are you on all of that?
Yes, I mean, I think one thing we can be certain of is that, first of all, Yellen certainly knows better than any of her predecessors that the Fed is in charge of interest rates. But I think we expect to see the Fed be very supportive of continued low interest rates. Even I think they've signaled if inflation starts to run a little bit hot, they just really feel that the recovery needs to be prioritized. As far as Yellen's focus on tax, trade, dollar policy, things of that nature, I think just to sum it up, I would say the expectation is that she will act quickly in support of the recovery, in some ways that we've seen before, and potentially in some new ways, but that will absolutely be a focus. So, if more QE is necessary, then I think we could expect that to happen and happen quickly. Again, depending on the outcomes over the next couple of months.
That's helpful. Chris, let's go to you. How do you think that fiscal policy is going to get reshaped here to close wealth and financial disparities? So there was a question in the Q&A about labor policies to expect. There's been conversations about a $15 minimum wage. There's been ideas around a universal basic income of some other shape. What can our audience expect with regards to the community and their employees and the like?
So a couple things in this kind of, run the gamut of kind of some sort of moderate to progressive democratic policies as well that you referenced. $15 minimum wage is part of the Biden agenda. It was part of what he, said should be in the stimulus package. I think because of the use of reconciliation, because that's a politically divisive issue, even among Democrats, that it will not be part of stimulus. So it remains to be determined how they might try to bring that back in, and it really has probably difficult to pass. Direct aid, there is certainly going to be extensive, and whether it's $1,400 to complete the $2,000, sort of promise of last year, that direct aid with a income cutoff will be part of stimulus. More broadly, ideas that were not really part of the discussion, if we think of the evolution from the Obama administration to the Biden administration, universal basic income was not really part of the discussion, is in the range of discussion and kind of Democratic priorities. I would kind of liken it to Medicare for all, that it is kind of in the progressive wing. It is not something that most Democrats will embrace right now, but the fact that it's part of the discussion drives other aspects, just like Medicare for all has driven expanded ACA access, expanded Medicare as potential healthcare policy. So I think that's kind of where UBI focuses right now, although stimulus payments are sort of a form of that. On broad labor policies, obviously Biden has been very pro-union and is trying to be as supportive of his unions as possible. How we see that play out in kind of specific labor policies, I think is still to be determined. There's not a specific policy around the gig economy, which is certainly where a lot of the modern economy is moving, and there have not been clear policy directives there, but they will have a labor department and a National Labor Relations Board that is much more favorable to unions and union activity and labor's voice at the negotiating table than in the prior administration, certainly.
Thanks, Chris. Evelyn, swinging back to you, how about corporate taxes or personal income taxes? What are your analysts and predictors saying about that, and what's likely to play out?
Yeah, so I mean, what we're being told is, I'm going to quote, "Consider everything to be on the table and pay close attention." So there's a lot of talk. I mean, certainly Democrats have put forth a variety of ideas, everything from increasing corporate tax rates to different types of tax on wealth, getting creative there around stock portfolios and other types of things. So I do think there is uncertainty there, and I certainly think there's going to be a lot more a debate and discussion about it. And in terms of how that could impact businesses here locally, one thing to think about besides just sort of the direct effect of tax change is the amount of merger and acquisition activity that we may see in 2021. So if you look at kind of a combination of the about $1 trillion of private equity money that's out there looking for yield, some of the demographics around business ownership in terms of age of your average business owner, we really expect to see a lot more acquisition and sale activity, really kind of deeper down into the smaller privately held company sector than we've seen in the past. So just something to be, kind of thinking about as it relates to business dynamics here in the region.
So that's an interesting bridge back to you, Chris, maybe for a minute. So the DOJ is, shall we say, on its front foot right now. And I think there's pressure from both Republicans and Democrats to take a more aggressive stance. If there's more M&A, it could be that more deals get contested. And it could be that the DOJ is looking at these things a little bit more aggressively. And then hanging over all of this is the active debate about whether the tech companies are too big and are overreaching too much and are too lightly regulated. And so given that there's such a strong, important contribution to our community made by the tech sector, particularly out on that Dulles corridor, but not exclusively there, what's your view on M&A and the Department of Justice and about the tech sector in particular as we go forward?
Yeah, and let me just weigh in just briefly on the corporate tax question as well, because that is a Biden priority, just like increased enforcement is as well. And I do think we'll see in the fall a Democrats only tax bill that will include pushing the corporate rate up into the mid-20s, whether 28% or something to that extent. Whether or not that can pass, still to be determined. But that will be, on the agenda in the fall. That was something Biden said he would do day one, which obviously he couldn't do day one, but will do, some attempt to do sometime in the first year. The increased enforcement around merger activity for large companies will be a significant focus of the FTC and the Federal Trade Commission and the Department of Justice. Increased enforcement around consumer protection across the range of financial services agency will be a major priority. I think the key policy shift that we may see, particularly as it affects big tech, I would say, is a potential shift in strategy away from, consumer impact based on price to entry into the market or barriers to entry into the market as an anti-competitive nature of large firms. So that can obviously impact different sectors of tech or different size firms in different ways. But I think that will be a key shift in the Biden administration strategy. But it is, tech antitrust remains front and center in Congress and in the Biden administration.
Really helpful. So we're in our last home stretch here. We have about 3 or 4 minutes left. And so let's end with a lightning round. So I'm going to go around the panel, and Jack, just to warn you, I'm going to end with you, and I'm going to ask you to answer the question as well as to close us out from your perspective. But in a minute or less, why don't each of you talk about either a new key player or a key policy in the Biden-Harris administration that you think will have an impact on the region and maybe even within the first 100 days, but which isn't getting a lot of press and people aren't talking about right now. So Stephen, why don't we start with you?
You may pick the person to start with on policy. I think that my focus will be on how they approach the pandemic and vaccines. I've made the recommendation to them, for example, that we loosen the restriction on using the vaccine at the bottom of a vial. Right now, we end up wasting some that in ideal times we could do. Right now, we should be using every drop. We're currently prevented from pooling that. So I would hope that they would see that they would take an executive action, either that or through the FDA on that.
Really helpful. Evelyn, how about you?
All right, I'm going to go with SEC. So Gary Gensler, there's just some interesting things on the plate now. I wouldn't say that this isn't something that's not being talked about. I think everybody's read or, chatted with friends and colleagues about GameStop, but also on his plate, he's got cryptocurrency. And if you look at his background, having been in academia, in the private sector, pretty well entrenched in technology, certainly spent time in the government. I think it'll be interesting to see how he tackles some of those projects, if you will. And then, of course, to Chris's point earlier around kind of regulation, we expect, him to be a more aggressive proponent of regulation on financial institutions and companies as well. So I'm gonna go with him as my interesting to watch.
Excellent. Chris, how about you?
That's a great name, and he really knows business, and he will affect how public companies have to report. I'm going to go with a name that's probably not as much in the news, Bharat Ramamurthy. He is the deputy at the National Economic Council, and I've picked him because his focus is on income inequality and race and economic disparities. So, and he's a former Elizabeth Warren aide, so it kind of gets to that tension within the Democratic Party between the progressive wing and the centrists about who will win out, but he's going to have a real influence on policy.
All right, before I swing back around to you, Jack, let me thank the Board of Trade and everyone who, all my co-panelists and Kavita, in absentia now, and everybody for providing us such a great webinar. I hope this was instructive to you. I'm going to take a little bit of my own vaccine, my own medicine here, and answer the question. We haven't talked a lot about foreign policy on this call, but there's a lot for an administration that's pledged to get back into the world community and has built on the back of sort of a free trade ideology. There's a lot of protectionism that's seeped into this administration. And I think we're going to see some surprising things on tariffs and pro-America policies that look almost more Trumpian than they look Clintonian maybe. And I think that's going to have an impact on the world stage. And it's going to cause some economic reverberations throughout the economy. So I have my eye on that. Jack, to you to close this out.
Well, great. Thanks, Evan. And thanks, everybody. That was a really interesting conversation. So Evelyn, Chris, and Stephen, and Kavita. I think one of the things that we're looking at here is OSTP at the White House, the Office of Science and Technology Policy, and just what is the innovation landscape going to look like going forward? And I think that has a huge impact on our region potentially. Really interested in where we might see things going with quantum computing. Also really interested to see where things might go with the hydrogen economy. So I know that's not short term, that's not immediate stimulus, and that's not with regards to getting our economy back up over the next 12 to 18 months. So certainly do look forward to an emphasis on that. But longer term, how do we think about our competitive position in the world going forward? And I think investments in those emerging technologies is going to be critical.
You want to close this out, Jack?
I think that's it. Yeah. So, I want to thank everybody again. This briefing will be available on our website later this week. So if you want to circle back to it, again, Evelyn, Chris, and Stephen, thank you so much for joining us. Really interesting. Hard to cover so many different topics in a short time, but I think we did a pretty good job there with Evan's help, keeping us on track. And with that, I wish everybody a great day and stay well.
Bye,
Thanks,
everybody.
everyone.
Thank you.
Thanks,
Bye.
everybody.